Welcome to the Stop Over Drinking and Start Living podcast, where high-achieving, goal-oriented rebel women come to learn how to live a vibrant and fulfilling life without requiring alcohol to get through it. No labels, no judgments, no saying you'll never drink again. Just real proven methods to help you stop rebelling against yourself with alcohol so you can drink less and do more. I'm your host, Angela Mascenik. Let's dig in. Welcome to episode 281, Addiction and Mental Health with Dr. Noell Rowan. Welcome back to the podcast. I have a very special guest, Dr. Noell Rowan, who has earned her BSW and MSW degrees from University of Georgia and a Ph.D. in social work from the University of Louisville. She is the professor of social work at UNCW and a gerontologist whose clinical experience, 30 plus years, is licensed in clinical social work and a clinical addiction specialist in North Carolina and a certified clinical supervisor. She's an academic FOCI and related to the health and quality of life of adults and older adults. She has authored more than 40 publications, including articles, co-edited a book, and book chapters. She was funded by the John A. Hartford Faculty Scholars Program in Geriatric Social Work and has been the recipient of several awards, including Distinguished Researcher UNCW College of Health and Human Services in 2024, and the David A. Peterson Award for lead author of Best Article in the volume of Gerontology of Geriatrics Education, and the Distinguished Educator Achievement Award by Kentucky Association of Gerontology Fellow, National Academies of Practice Distinguished Scholar Fellow of Gerontological Society of America, and the Mitt Joyner of ACSW Gerontology Leadership Award. Wow. What an honor to have Dr. Rowan on the podcast today. I actually met Dr. Rowan at my forest therapy certification that I obtained last year in Tennessee. Her and I learned the benefits of forest bathing and forest therapy and went through that training together. And she actually lives in North Carolina, not too far from me. And I had to have her on the podcast after learning about her research, especially with the addiction and her work with mental health for Mental Health Awareness Month. I hope you enjoy our conversation. She gives us amazing tips and ideas about how to feel better, some easy things that you can try right away, and most importantly, to recognize if you need more support to get the help that you need, and there's no shame in doing so. Welcome to the podcast, Dr. Rowan. Hi, Dr. Rowan. Welcome to the podcast.
Hi, thanks for having me.
You're so welcome. Thank you for coming. Well, the listeners got your sort of longer bio before we got into the podcast here, but why don't you just give a little introduction about yourself and who you are and what you do?
Thanks for the offer to be here today. And just a little bit about me, other than what's on that bio, is I am a longtime social worker, degrees in social work, and have worked in many different avenues of inpatient, outpatient, working with older people, working with teenagers, working with adults, and love it, and can't imagine myself doing anything other than something in the social work profession. I have my maternal grandmother was a social worker, and so I credit her for why I'm so passionate about this profession. Not that she said, now you should be a social worker, when I was a youngster, but I would just always admired her and loved who she was, and wanted to be more like her, although I don't think I am really like her, but professionally, I just really had a great deal of respect for who she was and what she stood for. So that was why I became a social worker, why I studied the profession, and why I'm so loyal to it. And now I have gone back and become an academic person. So I teach about social work and do research and still serve in many capacities and I could go on and on about that, but you don't want to hear all about all of that. But that's a general summary. And a lot of my work is with people with dealing with problems with alcohol and other drugs, as well as many different areas.
Well, thank you for that. That's amazing. Yeah, I feel the same way about being in service. It's just like I can't not do it. Like I sometimes I try and I'm like I'm not doing this anymore. And then I have another idea or it just happens. And so here I am. It's something I am very passionate about because I know what the struggle is, and I know what it's like when you get the support that you need and you get systems in place with family support and community support and what that feels like. And so I want to help people get to the other side of it too. So, yeah, I'm super excited for our conversation today. So it's Mental Health Awareness Month, and so I thought we would just kind of talk about that a little bit. And from your perspective and all of your years of experience, talking about mental health to kick us off here, how do we know if we have good mental health or if we need more support with our mental health?
Yeah, that's a good question. We just had a mental health awareness event at our school not too long ago, and we had tons of booths of people there representing all kinds of different ways of looking at taking care of ourselves and our mental health. And it can be anything as simple as drinking a hot tea that is more healing for us, or actually seeking counseling for our mental health. And one of the things that's really important about how to know when to ask for help is if you feel not quite right.
Mm-hmm.
If you think that your sleep is a little off, or you're sleeping too much or too little, or if your mind is racing a lot, you're crying more than usual, you just feel sort of like the blues in general, or maybe your appetite is not quite right, maybe it's too little or too much. It could be many different things that could prompt somebody to ask for help, but it's always a good idea to ask somebody, hey, could I benefit from help? Could I benefit from further counseling of some sort or coaching? Because I just don't feel quite right. And that's, it can be just as simple as that. Now, more serious would be if people are thinking about hurting themselves or somebody else, or sometimes people get into self-harm behaviors and could, a wide variety of those. And if people are hurting themselves or thinking about hurting themselves or somebody else, that's a huge red flag to, yes, immediately don't wait, go ahead and ask for help. And, you could even call 911 or call an emergency service for those matters.
Well, thank you. Would you consider over drinking or alcohol use disorder self-harm?
It certainly could be.
Yeah.
If it was a lot. There are a lot of people that can drink successfully and go right on about their way. But then there are some times when people are drinking a lot and, maybe they just don't feel very good and they just sort of plug through their day. But then there's a lot of times that people repeatedly overdrink, as you say, and that becomes an issue that needs exploration by somebody.
Yeah.
A counselor or a coach or some kind of assessment would probably be good in that case.
Yeah. Yeah, because I think a lot of people that are listening to this podcast and my clients, they know their drinking isn't good for them, but they still do it. So can we talk about that? I guess that would probably be a sign then that they need more mental health support, right? If it's not something that they can get a handle on.
Yeah. If folks know that they are drinking to a point where it causes them distress, or maybe they vomit, or they are shaking. One of the things that I tell the folks that I work with or supervise in the community, one of my favorite things to do is to ask people to hold their hands out just like this. And if you see any kind of a tremor with the fingers spread like that, if there's any kind of tremor, there's a sign that someone probably drank a little much the night before.
Interesting. Okay.
Yeah. Because when people drink too much, there's a tremor that happens after people are trying to go on about their business in their day. That's just one, what we call a withdrawal symptom.
Interesting.
A tremor. And it can actually be life-threatening over time. It could be a sign of, there may be a seizure coming. They may have heart distress. One of the jobs that I had a million years ago, it feels like, was I was a tech person in a mental health hospital for a long time. And they used to give me a clipboard back in the days of clipboards. And I used to have to monitor every 15 minutes of people who were in an isolation observation because they were drinking too much and they were coming off of that alcohol. And I had to make very detailed notes about how they were doing because they were at risk for a heart attack or any number of problems that could happen because they had been drinking so excessively. Now that's an extreme. That's somebody who's in hospital care for over drinking.
I just recently watched the Amy Winehouse movie. Have you seen that?
I did. I can't remember the details of it, but I did watch it when it first came out.
So there's a new one. I think it's called Back to Black, like the name of her famous song. And so it's all Hollywood, high produced. It's not a documentary. It's a dramatized version based on real events of her life. So she's not in it. There's an actress that plays her. I can't remember her name. She did an amazing job. So it's out in theaters right now. It's brand new.
Oh, okay. No, I haven't seen that.
Yeah, it's really good. You should watch it if you can sometime soon or wait for it to come out. But I'm always in about all the addiction movies and the books and the memoirs. Like I read all of them and watch all of them just because I like to stay close to that. And what was really interesting about Amy was that she was so young, and she had gotten sober. She put herself in rehab. And even though she has that one song that says, they tried to make me go to rehab. They did try, and she said no, but then she ended up putting herself in there, which was great. And then she had a long-term period of sobriety, and then she died from an overdrink because when I saw that movie, I was like, she did not plan for that to happen. And most people who end up like what you're talking about in the hospital, getting, being monitored for the withdrawals, don't plan for that to happen. And we're a lot closer to that happening than we think we are. I mean, it can just take one event, right?
That's right.
One event. And that's it.
And especially if people are mixing the alcohol with some of the drug, because there's so many things out there now that people think they're using this drug, but it's really laced with something else and it can be fatal.
Yeah.
Or place them in a hospital. Yes, we don't plan for these things.
We don't. No, we don't. It's not an intentional thing that we're like, I'm going to drink myself to death. And that's just unfortunately what happens. And I think we, because of the addiction and what our mind is telling us, and when we're in that process, we don't think that's going to happen. And then it does. And then that's really sad, And so I hope to get people before we get to that end, right? But it literally could happen to anybody. And I think it's really important to highlight and to mention that. So I don't know, have you seen the new data around the pandemic, post-pandemic alcohol with women? Have you read that?
I've looked at some of that, yes. And so I'm aware that during the pandemic, there was a lot of people staying isolated in their homes or somewhere, and they were drinking a lot.
Yeah. So they looked at the group. So basically what they did was and I'm totally summarizing here, I'll link this up in the show notes for the actual study and evaluation. They evaluated insurance claims for alcohol-related hospitalizations. And that's all they looked at. So the number of insurance claims, and then they dissected that even further for women aged like 45 to 65, there was an 80% increase.
Wow.
These are the people that are listening to this podcast right now. That is the main population here. And there's so much uptick around this specific population because the stressors of life are more intense. There's more financial responsibilities. There's more pressures. There's the stress and the anxiety and all the mental health side effects of being in the pandemic. And now here we are with a crisis with women drinking. And so I'm even more now passionate about reaching more people to help them see that you don't have to keep going on like this. So One thing that you've done is a lot of research, right, around addiction. And do you want to mention a little bit about that or some studies that you've looked at?
Well, yeah, there's several, and I won't go into a lot of detail just for time's sake, but my dissertation was looking at what really helps people who have been through some form of intensive treatment for some type of substance use disorder at that time, I think it still may be, but at that time was the nation's oldest and largest provider of treatment care for members of the LGBT community.
Mm-hmm.
And I traveled all over the country and did a great deal of work to find out what was most helpful, what made the most difference. And this included alumni of the Pride Institute and what there's a lot of detail, and there was a large statistical model involved, but the main things that made the difference was the culturally sensitive treatment, the care that they received, and that it was over a long period of time. The length of time in this culturally sensitive treatment was really the number one thing that made a big difference in their ability to abstain from alcohol. Alcohol was the main drug of choice of the people that went through Pride Institute at that time. And also the next greatest finding was that people were involved or affiliated highly with some kind of support system like Alcoholics Anonymous or some sort of support that made a real meaningful difference for them. And the thing that's important about the culturally sensitive care with this particular treatment population is that there's still out there that we need a lot more research, but there is some health disparities that are unique treatment needs for people who are lesbian, gay, bisexual, or transgender. And then we have the Q and the QIA and the Two-Spirit and all that. But I was just mainly focused on LGBT folks. And there's some health disparities known in the literature that there's just not a whole lot of culturally sensitive health care provided for people who are members of the LGBT communities. And therefore, a lot of folks who are LGBT will avoid care because they don't think they're going to be treated well. And there's a risk for discrimination. And a lot of other things that I could go into, basically. But that culturally sensitive care really can make a difference over a longer period of time, and not just in and out and, okay, we're well now. It can take a long time to gain that care and support to be able to not have problems with alcohol.
Yeah. So can I summarize what I just heard from you a little bit?
Sure.
So what I'm hearing from you is that it was important for these people that you looked at, the LGBTQ community, to find a support and program, inpatient program, where they felt safe to share the real issues that they were facing.
Yes.
And when they felt safe to share actually what was happening with them or to them, right? Because it's both sometimes. They then were able to get help that they needed and felt more connected with the providers or the ongoing support system in community with others.
Yes.
Yeah.
Because there's a lot of things that I was finding at that time about less secret keeping when people were feeling safe in their culturally sensitive care. And they did a whole lot of work around gay and lesbian culture, primarily because that was the highest number of folks who were going in there were mainly gay men at that time. So it was really important that people were assured that, they weren't these marginalized people that should be ignored or discriminated in society, which is, a lot of these hate crimes and things like this, and people who have endured difficulties in their life. Minority stress is really important to think about, the stress that people have to endure if they're a member of any kind of minority.
Yeah.
but so these are all reasons why this culturally sensitive care over time made a difference.
Yeah, it's amazing. Yeah, thank you for sharing that. When I think about that, women can be considered a minority, right? Like we have a
Yep.
different experience than the man, and white women have a different experience than black women, and all
Uh-huh.
of that, right? And
Yep.
it's so important to find a place that you feel safe and seen and people understand you.
Yep.
Otherwise, you're not going to speak up. You're not going to share what's going on if you don't feel like people understand where you're coming from. It's
Right. And
amazing.
that's so important when there's alcohol use disorder on the line.
Yeah, you have to be
It,
honest, right, with what is
yeah,
going on.
because it's so easy to try to conceal it and try to just put the face forward and go on with life.
Yeah.
And it perpetuates the problem with alcohol.
Yeah.
So it's really important that people feel safe. People
Yeah.
feel like that the people providing the care, whether it's medical care, mental health care, addiction care, that there's some sensitivity to who people are and where they've come from.
Yeah. Yeah. I can't tell you how many times that women have told me that they've shared with their doctor, that about their drinking, and how they come in and just immediately judge and shame them without providing any type of resources. Like it happens all the time.
Wow.
And they just aren't, I don't know if they're not trained or they don't understand, or they just don't know how to deal with it. But like, that's too much. And they just come in and say, you have to cut back, or you can't do that. It's not good for you. And like, what does that leave them with, right? They're just feeling bad about it. And this is why also people don't report, because they're worried about, what their doctor is going to say, or it's going to be on their record. And so they don't get the help that they need for a long time.
Unfortunately, a lot of regular health providers just don't have the training in working with people with addiction or mental health either. So that's another reason why there are people that hire a professional that come in and do triage kind of work to supplement the healthcare providing. Yeah, but there are like I work with nurses a lot, and they do have nurse practitioners that are trained to work with people with mental health and addiction, but it's rare because it takes extra care. It takes extra coursework. It's a whole other degree program. It's internships. It's a lot of money. It's a lot of time. And there are a lot of people that just don't want to invest like that in their career. And so they just take the shorter route and just become a nurse and just become a doctor or respiratory therapist or whatever. And they aren't trained to work with mental health and addiction. So that's why it's important to have folks like you and folks like me and social workers and mental health providers out there that can help assess and screen and connect people with the resources that would make a difference for them.
Yeah, I agree. So what about the connection of addiction and mental health? Like, can we talk about that a little bit?
Oh, goodness. Now, that's a hard one to separate.
Right? It's all very connected. Yeah.
It is. It is very connected, but, it's very difficult to tease out and to make it separate. But there are some things that are pertinent for alcohol use disorder or substance use disorder that's separate from something like depression, anxiety, schizophrenia, things like this. But there's just so much overlap, that it's hard to separate them totally.
Yeah. Well, when I think about the two of them, when I think you're suffering mentally, like if you feel depressed or you're having high levels of anxiety or whatever it is, right? You're feeling off in some way. Is it true, or how would you describe the tendency for our minds to want to seek relief from that? And so then we go look for things to make ourselves feel better. Right? So that's the process of it, right?
Yes, absolutely. I use the analogy a lot in the classroom of, hey, have you ever had a toothache or broken an arm and you've just been in pain? And that is just all you can think about is get the relief of that pain because it's so unusual and it's demanding of your attention to get rid of that pain. And so I use that analogy to help people who may or may not have ever felt an urgency around using alcohol or some other drug, it's really the same thing, that people start drinking and it's no big deal. And then there is an urgency, like a runaway train, that they have got to get that next drink. They have got to get that next drug. Or else it feels like, it's like their life is on the line. They've got to do it. They may be having withdrawal symptoms. They may have this 3-man band, I call it, headache. They may have, shakes. They may just feel very, their moods may be all over the place. They may just be lashing out at people. They may just, not be able to get out of the bed, all kinds of things. And that in itself is pain that needs to be controlled or needs to be quelled. And so that next drink or that next drug is the source a lot of times.
Yeah. Which then creates the pain again, right?
The whole cycle
continues
over and
again.
over.
Yes. Yeah.
And it's I call it a runaway train, because it's hard to stop and especially if people are really deep in the cycle, it's next to impossible to stop by oneself.
Yeah, we talked about that before we started recording, right? So like, I'm calling it, once that ship has sailed, right? And you recognize that you can't stop that cycle. Like, you're in the cycle, whatever that looks like. It could be very extreme where you're not getting out of bed, you're not functioning, or it could just be that cycle of weekly or nightly drinking after work. Like, whatever the cycle is that you feel like you can't control, that ship has sailed, right? That is the time to recognize that you need more support.
Yep.
Yeah.
Yep. And it's really a good thing to reach out for help.
Yeah.
To pick up the phone and call somebody that you think will understand.
Yes.
To, whoever that is. Even if you don't know who they are, you can just ask them for help. And another thing that I like to teach people is a skill called share, check, share. So you share a little bit about what's going on and check the person's response. And if it's a good supportive response, then that is a signal, okay, to share a little bit more.
I love that.
And so it's share, check, share, and it keeps you from being so vulnerable to be harmed by somebody who's really not available to you at that moment for whatever reason.
Yeah, or may not understand it, or, want to get in that with you. Like, sometimes, you've got friends that are just like, that sounds like too much. I don't want to get involved in that, right? So they are guarded with some of that stuff. I love that. Share, check, share. What a great concept. A lot of people are scared to share that they need help. And this is a great way to test the waters a little bit around trying to figure out what you need. I love it.
Yeah. And sometimes, people may just be in so much pain that it's hard to do that little bit share and check. But it's important when you're trying to get close to another person to just test the waters a little bit, to protect yourself a little bit, because some people are just harsh. They have no idea how to respond and be emotionally present, especially if you're talking to somebody who's not a professional. And so it's really important.
Is there anything that you've seen professionally since the pandemic around addiction? I'd like to talk about that for a few minutes.
Yeah, well, I mean, since the pandemic, the need for mental health professionals and people working in addiction and mental health has skyrocketed. The numbers of people that are coming through our school has increased, and the numbers of people who are in demand for, jobs when they get out has increased. In many different arenas, but it just shows that people are in a lot of pain out there. And when they've been through something as just life-changing as the pandemic has been, people need support. And a lot of people are still afraid to go out of their homes for mental health reasons, as well as they're just not sure about their safety, about what kind of illnesses are out there in the world that they're going to breathe. And I still hear stories like that they're afraid to go out, and that could lead to a mental illness in and of itself. Isolation is a big concern.
Mm-hmm.
And it can really harm people over time to be isolated, and to drink and to use drugs. Clearly is an issue that, as we talked about earlier, has increased because of the pandemic. So a lot of people are in pain for a lot of reasons since the pandemic, and it really changed our world. It changed it tremendously.
Yeah.
The good news about it is I think it's really opened up electronic forms of support that people were hesitant to reach out to before. That is something that I've seen. Telehealth, even like regular medical providers are extending their ability to see people online that they would never do before. So I think that's good. It's also good people who are doing podcasts like you are. That's new. You know, we used to not have those resources. People are doing telehealth, mental health, and addiction care online. That didn't used to be is such a prevalent, you know, opportunities all over the place, all over the world. You know, so the connections in that regard since the pandemic has certainly been good, and I love it because, you know, everybody, you know, needs a different avenue of support. Not one way works for everybody.
That's
so
true.
Lots of choices and lots of electronic connections are possible. So in that way, I love that what we've got available, but there's always something new that needs to be developed.
Yeah. Thank you. Yeah, I feel very fortunate. You know, I had my business online before the pandemic, so it's always been that way unless I do something in person like a retreat, that allows people, you know, to be in the comfort of their own home or their own private space without having to travel. Removing that travel barrier, you know, or commute or having to leave work or something like that to get the care that they need, the support they need is huge. You know, I have a lot of people who take their calls from the car. They just, you know, go out from their office and they sit in the car and they get on the video and, you know, they have a session, which is a beautiful option to have to remove that barrier that they need to go somewhere in person.
Libraries are also a fun place. I've had people meet me on the library call.
Oh yeah.
They can go to a place, you know, and have a Wi-Fi connection and shut the door inside somewhere if they don't want to be in their car.
Yeah.
But there's all kinds of creativity out there to connect with people.
Yeah, it's amazing. So what kind of tips do you have for people as a mental health professional for Mental Health Month? Like, what do you think somebody just kind of listening be like, I could probably use some support, not quite sure what my support might look like with hiring somebody, but what can I do on my own to improve my mental health?
Well, I mean, sleep is a big one. You know, if you're able to curtail your sleep and you're able to go to bed a little bit earlier, or, you know, sometimes people just need to sleep a little bit longer. It used to be, people would say somewhere between 6 and 8 hours of restful sleep is good. But I heard recently a little bit longer than that's even better, like 9 hours, if people can get that. You know, people who work overnight jobs, there's an automatic issue that they're not getting enough like sunlight in their day can certainly cause some issues. So if somebody is working overnight and they're not able to get natural light when they're having a day off, maybe spend a little bit more time in the natural light to get, because there is, you know, vitamin D comes from the sunlight and it's really important for our nourishment. Things like this, drinking more water can actually help our outlook on life. Not drinking so many, you know, if you drink sodas or things that are sugary, cut back on that and drink more water. Drink some hot tea. Those kinds of things can soothe the soul. Or be outside in nature. You and I know about that, and we both love that. And just being able to go outside, and I'm looking at some trees right now outside of my window, and that nourishes me. It's really important to be able to have connection with nature in some kind of way. It doesn't have to be immersed in the forest, but some kind of connection can make a difference in someone's outlook. And eating well, eating nutritious foods, things like that those are just simple tips that I think can make a difference if people make a little bit of a change in that, and maybe not watching so much TV or playing video games or things like this. Being more attuned with the body and focusing more on what makes a difference for folks. Because, one thing may soothe one person and it may not the others. So it's important to pay attention to what it's calling to you.
Yeah, I love that you brought up the nature thing. I'm surprised I didn't remind people that's how we met. It was when we were getting our certification for nature therapy, right? And forest bathing.
Forest bathing, yes. And I love that to this day. And there's just something really soothing about that. And you and I were learning about the amount of research behind that and how it can really make a huge difference in people's outlook and overall wellness to be able to take in what the outdoors gives us and to breathe in the natural air can make a huge impact.
It really does. And I think you can test this out by noticing how you feel when you're on your phone and scrolling for more than 10 or 15 minutes. Like for me, I actually feel gross when I'm doing that too much. Like I feel myself getting all tight and right. It's just like, it doesn't feel good. That's all anyone needs to know. It's just, it doesn't feel good. Right. Same thing if you watch too much TV. Like sitting there and watching and like you're probably scrolling on your phone and watching TV and like you're not even paying attention, right? Those are signs that like that doesn't feel good to you. But if you go outside for 5 minutes and you sit under a tree or put your feet in the grass and you take some deep breaths, you will notice that actually feels good. I guess not for everybody. That might not feel good, but you just should try it and notice the difference and like start doing things that feel better versus things that don't. And it can be something so easy as that. I love that you mentioned the water and the sleep, like and eating well. Like those are some basic things that people can focus on, give them something to focus on to do. I think little projects also help too. If you're struggling, like give yourself a little goal. Maybe your goal is to just drink 8 glasses of water a day. And that's all you focus on, because then you get a little sense of accomplishment going, and that makes you feel better that you're actually doing something and working towards something.
Yeah, and a couple of other things are coming to mind as I'm listening to you. And one is that I learned actually in the pandemic, the importance of taking a shower or a bath.
Yes.
And, particularly to wash away. You can do all kinds of visualizations when you're in there, but it's a way to wash away whatever ails you. And it, sometimes I like personally more steam, that seems to get whatever out of me, or sometimes it's more cold. So I read recently that if you put yourself into a extreme cold environment just for a brief moment, that can help your nervous system. So if you open your freezer and just put your head in there for a second and come back out, it really can interrupt the stress cycle, that whatever you may be too nervous about something. The other thing that I wanted to say, a simple hint, and another thing that I talk a lot about with people that I work with, is meditation, and that the oldest form of meditation is journaling. And it doesn't have to be a fancy journaling situation with a fancy journal, although it could be. But the most important thing about journaling is that people feel free to write whatever is on their heart and mind at the moment. And it doesn't even have to be a long amount that you are writing. But what's most important is the person is free, that they don't feel like someone's going to come behind them and read what they just wrote, that they keep it as sacred, place where they can release whatever's on their heart and mind. And doing that pretty regularly can really make a huge difference in someone's mental health and their perspective on the world.
I 1000% agree with you. That is like writing. However you choose to write, some people have a hard time holding a pen and actually putting it on paper, but most of the people listening are able to do that. Any way that you can extract what you're thinking and feeling and get it out, it's like taking out the garbage, right? It's just like you're releasing all of that out of you, and you feel so much better. It's like taking a shower. It's like showering your mind. You get that out. The process of of what's in your mind and then like putting it through your hand and on a piece of paper, like there's a process, there's something to that is so freeing and helps lighten you up tremendously. So I'm glad to hear you mention that. I love journaling. That is one of the very basics that I do on my regular mental health support checklist is regular journaling and evaluating, especially when I'm navigating difficult situations. If something gets triggered, or I'm dealing with something with my kids or at work or a difficult situation, writing those thoughts out on a piece of paper. And then if you don't feel like you want that laying around, you can just rip it up and throw it away.
Yeah, burn it, whatever.
Yeah.
Yeah.
Yeah. Yeah, it's an excellent tool. So we're here to say that this doesn't have to be a complicated or a daunting thing to do some small things to improve your mental health, right?
Right.
Yeah. And if you recognize some of the things that Dr. Rowan was sharing at the very beginning, where if you're not sleeping, right, if you're overeating or undereating, it's hard getting up out of bed, you feel off, you're feeling blue, those are signs that it's important to reach out for help in some way, shape, or form. And to remember that anybody can have an incident with alcohol that leads them in the very wrong ending direction. And nobody's immune from that.
Right.
Nobody's immune from that, right? Like, there's nothing, can you reinforce, I always say there's nothing wrong with you if you overdrink. Like, you're not a broken person if you struggle with this. Like, people struggle with all sorts of things. The people listening to this podcast, it's alcohol, And that's just the thing that they happen to present with. And it doesn't mean that they're broken, that there's something wrong with them, or they're faulted in some way. Can you talk about that a little bit, just as we wrap things up?
Yeah, I mean, alcohol is everywhere. It's all over our media. Mm-hmm. It's all over expected things to have at a dinner party, a work party. It's everywhere. So it's just, commonplace to have a drink. And sometimes having many drinks is just like natural. Mm-hmm. It's natural to do. And sometimes people can do that and go right on about their life. But other times it just doesn't feel right, and it's important to get help for it. It's important to ask, is this a problem? Mm-hmm. How come I can't stop drinking so much? Mm-hmm. What does this mean exactly? Does this mean that I'm an alcoholic? Does it mean that I need to make some changes? What does it mean? And it's really important to ask somebody that can actually support and walk through it with them.
Yeah. Thank you so much. Any last comments, thoughts, or suggestions for people listening?
Oh, my goodness. I think we've covered so much. I'm just so grateful for the opportunity to reach a large audience like this. And I just want to applaud the people that are on this podcast, that they're paying attention to themselves and that they're opening up to some support, whatever that looks like, whatever works for people. Because the last thing that you want to do is to entertain those little twists in the mind that say you shouldn't ask for help, because that is what will lead people to more serious health problems. So I just want to applaud people for paying attention to it and reaching out for help.
Well, thank you so much. I couldn't have said that better. The people that are listening to this podcast recognize that they don't like their relationship with alcohol. And that's the first step, is actually seeing this isn't working for me. So like, they've Googled it, they've been recommended it. Somehow they've taken the step to figure out, okay, what can I do about this, right? And if you've recognized you're further along the process or further down the line, like we talked about in the beginning, get some mental health support. We're going to link up some of the resources we talked about here in the podcast for you. I'm a resource, and there's all sorts of resources available. And that you don't have to do this alone. And your study that you did, just to recap that, showed long-term support with like-minded people is the key to long-term recovery. Yes?
Yes.
Yes. And so remember that it can take longer than you think it should, and you should just give it as much time as it takes.
Absolutely.
Yeah. Thank you so much, Dr. Rowan. So much. I can't wait to hang out with you in Carolina Beach this summer.
Yay!
Yay! And we will talk about more things soon. Thanks for coming on. What an amazing episode. I hope you all enjoyed that conversation as much as I did having it. I have linked up some of the ways that you can get in touch with Dr. Rowan in the show notes, and other ways of support in North Carolina if you seek additional support outside of what I'm able to help you with. The most important thing is that you do get help if you recognize that that ship has sailed where you cannot figure this out on your own, and that doesn't mean that there's anything wrong with you. All right, we all need support in different ways in our lives. So thank you for listening, and I will talk to you all next week. I want you to check out angelamascenik.com/aliveaf. You know what it's like to have a desire to cut back on your drinking, right? You start to read books, listen to podcasts, try things, but you might not be able to yet put all the pieces and suggestions together in a way that actually makes sense and works for you. You might struggle with beating yourself up after an overdrink. You might get frustrated with yourself when you take 2 steps forward and then another 2 steps back, and get overwhelmed with what's right and wrong about your relationship with alcohol. Your friends tell you that you should be able to have just 1 drink, and it isn't a big deal. You might be white-knuckling through urges and resisting instead of peacefully processing them. And you might struggle with your identity as someone who has enjoyed having a lot of wine or alcohol in your life. It's around you all the time. It's what you do and who you are. Well, after 5 years of successfully coaching hundreds of women through these struggles, I have created the Alive AF membership, where women like you can learn the basics on what it takes to cut back and reach your goals with alcohol, whether it is to just drink less or totally quit. And when you join, you will get the exact framework I used to change my own relationship with alcohol and still use today, that has led me to be alcohol-free for over 5 years. You're going to get access to my resources, videos, and worksheets that have been proven to change and reduce how much you drink. Every day you can ask questions, share your obstacles, and get coaching and direct support on the challenges you will face with love and no judgment. Also, you will get immediate access to workshops like uncovering your alcohol identity and changing it, how to say no to things that don't support your new identity or life or goals, aka boundaries. A workshop called Creating Emotional Agency, and another one, How to Manage Your Mind to Succeed at Your Goals, and more. Every month we have a brand new workshop. These workshops are filled with step-by-step prompts and instruction to help you create the exact relationship with alcohol that is best for you. My mission and vision for Alive AF is to be a hub of support and resources for women to come and learn how to do what is best for them and becoming more alive in the process. When you join, you're going to learn how to take care of yourself better, how to feel good and become more alive and go after the life that you really want. I want this membership to be affordable and an easy solution where you can get all the help you need in one simple place whenever you need it. So, no need to go read another book, find a new podcast, attend a free webinar, or go down the path of piecemealing it all together. Join Alive AF and have it all there in one place for you anytime you need it. So, go to angelamascenik.com/aliveaf, and enrollment is open right now. See you inside.